The current healthcare system in the United States isn't investing enough money in adequate diabetes coverage. Diabetes is one of the most expensive chronic diseases in America, and currently people with diabetes are not getting the supplies and medication they need to control their diabetes long term. People often have very high out-of-pocket expenses, and so they can't afford their medication or diabetes testing supplies. Insurance companies can currently deny claims for people with diabetes, or they can refuse to allow them under their insurance coverage simply because they have diabetes. Finally, our country doesn't emphasize diabetes prevention or early recognition, and often people with early diabetes are left to develop complications long term because they're not getting the care that they need. It's hopeful that the Affordable Care Act will really help people with diabetes. For example, insurance companies will no longer be able to deny people on pre-existing conditions such as diabetes. Secondly, families will have out-of-pocket annual caps on their own costs associated with medical supplies such as diabetes testing supplies and medications. This will really help control costs for each family member and individual long term. Thirdly, the country is trying to move more towards preventative care and coverage, so people with diabetes should have more preventative care offered for free. You may be wondering, what can you do to help with all of this? There is something you can do. Advocate. Tell your primary care doctor or even tell state and local officials that you support the Affordable Care Act and the things that it's trying to accomplish for diabetes. Secondly, challenge the current ways of thinking. It's going to take many years for all of the Affordable Care Act legislation to fall into place. In the meantime, support preventative health care and let people know that this is very important as far as managing diabetes long term. Finally, thoughtfully consider your diabetes or the diabetes of your loved one. What does it take for you or your loved one to adequately manage diabetes, and what medications, supplies, and preventative care do you need in order to make this happen?